In the realm of antibiotics, clarithromycin stands as a potent ally in combating various bacterial infections. This macrolide antibiotic has garnered widespread recognition for its efficacy and versatility, making it a valuable addition to the medical arsenal. As we delve into the intricacies of this medication, we will unravel its common purposes, benefits, potential side effects, dosage recommendations, and the precautions necessary for its safe and effective use. Clarithromycin belongs to the macrolide family of antibiotics, a class known for its broad-spectrum activity against a wide range of bacteria. Unlike some of its counterparts, clarithromycin boasts an impressive ability to penetrate tissues, allowing it to reach and combat infections deep within the body. This unique characteristic contributes to its versatility and efficacy in treating various conditions. Throughout this comprehensive exploration, we will gain a deeper understanding of clarithromycin's role in modern medicine, equipping ourselves with the knowledge necessary to make informed decisions regarding its use. Whether you are a healthcare professional, a patient, or simply seeking to expand your understanding of this antibiotic, this video will serve as a comprehensive guide, illuminating the intricate details surrounding clarithromycin's applications, benefits, and potential risks. Common purposes of clarithromycin. Clarithromycin finds its application in a diverse array of medical conditions, owing to its broad-spectrum activity and tissue penetration capabilities. Let us explore some of the most common purposes for which this antibiotic is prescribed. Respiratory tract infections. One of the primary uses of clarithromycin lies in the treatment of various respiratory tract infections, including acute bacterial bronchitis, acute bacterial exacerbations of chronic bronchitis, community-acquired pneumonia, pharyngitis and tonsillitis caused by Streptococcus pyogenes, group A beta hemolytic streptococci, skin and soft tissue infections. Clarithromycin's efficacy extends to the treatment of skin and soft tissue infections caused by susceptible bacteria, such as impetigo, cellulitis, erysipelas, Helicobacter pylori infections. In combination with other medications, clarithromycin plays a crucial role in eradicating Helicobacter pylori, the bacterium responsible for peptic ulcers and chronic gastritis. Mycobacterial infections. Clarithromycin finds application in the treatment of certain mycobacterial infections, including disseminated or pulmonary infections caused by Mycobacterium avium complex, MAC, leprosy, in combination with other antimicrobial agents. Sexually transmitted infections. In specific cases, clarithromycin may be prescribed for the treatment of certain sexually transmitted infections, such as non-gonococcal urethritis and cervicitis caused by Chlamydia trachomatis. It is important to note that clarithromycin's effectiveness is limited to bacterial infections and does not extend to viral or fungal infections. Healthcare professionals carefully evaluate each patient's condition and medical history before prescribing clarithromycin to ensure its appropriate use and maximize its therapeutic benefits. Benefits of using clarithromycin. Clarithromycin offers a multitude of benefits that contribute to its widespread use and clinical significance. Let us explore some of the key advantages associated with this antibiotic. Broad-spectrum activity. Clarithromycin exhibits activity against a wide range of bacteria, including gram-positive and gram-negative organisms, atypical pathogens, and certain anaerobes. This broad-spectrum coverage allows for its effective use in treating various types of infections. Tissue penetration. Unlike some antibiotics that struggle to reach deep-seated infections, clarithromycin boasts excellent tissue penetration capabilities. This characteristic enables the antibiotic to effectively target and eliminate bacteria residing in tissues, making it particularly useful for treating respiratory tract infections, skin and soft tissue infections, and certain mycobacterial infections. Once-daily dosing. Clarithromycin's extended half-life allows for once-daily dosing, which can enhance patient compliance and convenience. This simplified dosing regimen can improve treatment adherence, leading to better clinical outcomes. Efficacy against atypical pathogens. Clarithromycin demonstrates potent activity against atypical pathogens, such as Mycoplasma pneumoniae, Chlamydia pneumoniae, and Legionella pneumophila, which are often implicated in respiratory tract infections. This characteristic makes clarithromycin a valuable treatment option for infections caused by these challenging microorganisms. Favorable pharmacokinetic profile. Clarithromycin exhibits favorable pharmacokinetic properties, including good oral bioavailability, extensive tissue distribution, and a relatively long elimination half-life. These characteristics contribute to its clinical efficacy and convenient dosing regimen. Minimal drug interactions. Compared to some other antibiotics, clarithromycin has a relatively low risk of drug interactions, making it a suitable option for patients taking multiple medications concurrently. While these benefits highlight the advantages of using clarithromycin, it is crucial to weigh them against potential side effects and follow dosage recommendations carefully to ensure safe and effective treatment. Potential side effects of clarithromycin. Like most medications, clarithromycin may cause side effects in some individuals. It is essential to be aware of these potential adverse effects and promptly report any concerning symptoms to your healthcare provider. Here are some of the common side effects associated with clarithromycin. Gastrointestinal disturbances. Clarithromycin can sometimes cause gastrointestinal side effects, such as nausea, vomiting, abdominal pain, diarrhea. Taste disturbances, metallic taste. Allergic reactions. As with any medication, there is a risk of allergic reactions, which can range from mild skin rashes to more severe reactions like anaphylaxis. Seek immediate medical attention if you experience symptoms of an allergic reaction, such as difficulty breathing, swelling of the face or throat, or hives. Liver enzyme elevations. In some cases, clarithromycin may cause an increase in liver enzyme levels, indicating potential liver injury. Regular monitoring of liver function tests may be necessary, especially in patients with pre-existing liver disease or those taking clarithromycin for an extended period. Cardiovascular effects. Clarithromycin has been associated with a potential risk of prolonging the QT interval on electrocardiograms, ECGs, which can increase the risk of developing an abnormal heart rhythm, arrhythmia. This risk is generally higher in patients with pre-existing cardiovascular conditions or those taking certain medications that can also prolong the QT interval. Myopathy, muscle weakness. Rarely, clarithromycin may cause myopathy, a condition characterized by muscle weakness or pain. This side effect is more likely to occur in individuals with underlying renal impairment or those taking certain medications that can interact with clarithromycin. Antibiotic-associated diarrhea. As with other antibiotics, clarithromycin can disrupt the normal gut flora, leading to antibiotic-associated diarrhea, which can range from mild to severe in some cases. It is important to note that not all individuals will experience side effects, and the severity may vary from person to person. If you experience any concerning symptoms while taking clarithromycin, promptly consult your healthcare provider for proper evaluation and management. Dosage recommendations for clarithromycin. Proper dosing is crucial for ensuring the effectiveness of clarithromycin while minimizing the risk of adverse effects. The recommended dosage may vary depending on the specific condition being treated, the patient's age, weight, and overall health status. Here are some general dosage guidelines for clarithromycin. Adults and children over 12 years old. For most respiratory tract infections and skin, soft tissue infections. 250,500 mg twice daily for 7-14 days. For Helicobacter pylori infections, in combination with other medications. 500 mg twice daily for 10-14 days. Children under 12 years old. The dosage is typically based on the child's weight or body surface area. For most infections, the recommended dose is 7-5 mg per kilogram twice daily, up to a maximum of 500 mg per dose. Renal impairment. In patients with renal impairment, dosage adjustments may be necessary to prevent accumulation of the drug and potential toxicity. The dosage should be reduced based on the degree of renal impairment and monitored closely. Hepatic impairment. Clarithromycin should be used with caution in patients with severe hepatic impairment, as the drug is primarily metabolized in the liver. Dosage adjustments may be required, and close monitoring of liver function is recommended. It is essential to follow your healthcare provider's instructions carefully and complete the entire course of treatment as prescribed. Stopping the medication prematurely or skipping doses can lead to treatment failure, antibiotic resistance, and potential relapse of the infection. Dangers and precautions of using clarithromycin. While clarithromycin is generally well tolerated and effective, there are certain dangers and precautions to be aware of to ensure its safe and appropriate use. Drug interactions. Clarithromycin can interact with various medications, including certain antiarrhythmic drugs, anticoagulants, antifungal agents, and medications metabolized by the cytochrome P453A4 enzyme system. These interactions can lead to increased or decreased drug levels, potentially causing adverse effects or reducing the effectiveness of the medications involved. It is crucial to inform your healthcare provider about all medications, supplements, and herbal products you are taking to avoid potentially harmful interactions. Prolonged QT interval. As mentioned earlier, clarithromycin has the potential to prolong the QT interval on electrocardiograms, ECGs, which can increase the risk of developing an abnormal heart rhythm, arrhythmia. This risk is generally higher in patients with pre-existing cardiovascular conditions, electrolyte imbalances, or those taking certain medications that can also prolong the QT interval. Close monitoring and caution are advised in these situations. Myasthenia gravis. Clarithromycin should be used with caution in patients with myasthenia gravis, a chronic autoimmune neuromuscular disorder. The antibiotic may exacerbate the symptoms of this condition by interfering with neuromuscular transmission. Antibiotic resistance. Like other antibiotics, the inappropriate or excessive use of clarithromycin can contribute to the development of antibiotic resistance. It is essential to follow the prescribed dosage and duration of treatment to minimize the risk of resistance and ensure the continued effectiveness of the medication. Clostridium difficile-associated diarrhea, CDAD. As with other antibiotics, clarithromycin can disrupt the normal gut flora, potentially leading to the overgrowth of Clostridium difficile, a bacterium that can cause severe diarrhea and colitis. Prompt medical attention is necessary if you experience persistent or severe diarrhea while taking clarithromycin. Pregnancy and breastfeeding. Clarithromycin should be used with caution during pregnancy and breastfeeding, as its safety in these situations has not been fully established. It is essential to discuss the potential risks and benefits with your healthcare provider before taking clarithromycin if you are pregnant or breastfeeding. By adhering to the prescribed dosage, following the treatment regimen carefully, and promptly reporting any concerning symptoms, you can minimize the risks associated with clarithromycin and maximize its therapeutic benefits. Clarithromycin versus other antibiotics. In the ever-evolving field of antibiotics, it is important to understand how clarithromycin compares to other commonly used antimicrobial agents. While each antibiotic has its unique characteristics and indications, here is a brief comparison of clarithromycin with some other notable antibiotics. Clarithromycin versus azithromycin. Both clarithromycin and azithromycin belong to the macrolide class of antibiotics and share similar mechanisms of action and indications. However, azithromycin has a longer half-life, allowing for once-daily dosing or shorter treatment durations, which can improve patient compliance. Clarithromycin may be more effective against certain respiratory pathogens, such as Haemophilus influenzae and Streptococcus pneumoniae. Clarithromycin versus amoxicillin. Amoxicillin is a penicillin-based antibiotic with a narrower spectrum of activity compared to clarithromycin. Clarithromycin is generally more effective against atypical pathogens, such as Mycoplasma pneumoniae and Chlamydia pneumoniae, which are commonly implicated in respiratory tract infections. Amoxicillin may be preferred for certain infections, such as otitis media, ear infections, and sinusitis, where it has demonstrated good efficacy. Clarithromycin versus fluoroquinolones, e.g., ciprofloxacin, levofloxacin. Fluoroquinolones are broad-spectrum antibiotics with a different mechanism of action compared to clarithromycin. Fluoroquinolones may be preferred for certain respiratory tract infections, such as community-acquired pneumonia, due to their potent activity against common pathogens like Streptococcus pneumoniae and Haemophilus influenzae. Clarithromycin may be a better choice for infections caused by atypical pathogens or in situations where fluoroquinolone resistance is a concern. Clarithromycin versus cephalosporins, e.g., cefuroxime, ceftriaxone. Cephalosporins are broad-spectrum antibiotics that are commonly used for various bacterial infections, including respiratory tract infections and skin, soft tissue infections. Clarithromycin may be preferred for infections caused by atypical pathogens or in cases where cephalosporin resistance is a concern. Cephalosporins may be a better choice for certain infections, such as meningitis or sepsis, where they have demonstrated good penetration into the central nervous system. The choice of antibiotic ultimately depends on various factors, including the type and severity of the infection, the causative pathogen, patient characteristics, age, allergies, comorbidities, and local resistance patterns. Healthcare professionals carefully evaluate these factors to select the most appropriate antibiotic for each individual case. Clarithromycin and its role in treating specific conditions. While clarithromycin has a wide range of applications, it plays a particularly crucial role in the treatment of certain specific conditions. Let us explore some of these conditions in greater detail. Community-acquired pneumonia, CAP. Clarithromycin is often recommended as a first-line treatment option for community-acquired pneumonia, either alone or in combination with other antibiotics. Its broad-spectrum activity and excellent tissue penetration make it effective against various respiratory pathogens, including atypical pathogens like Mycoplasma pneumoniae and Chlamydia pneumoniae, which are common causative agents of CAP. Acute bacterial exacerbations of chronic bronchitis, AECB. Clarithromycin is widely used in the treatment of acute bacterial exacerbations of chronic bronchitis, a condition characterized by increased cough, sputum production, and breathlessness in patients with underlying chronic bronchitis. Its activity against common respiratory pathogens, such as Haemophilus influenzae and Streptococcus pneumoniae, makes it an effective choice for managing these exacerbations. Helicobacter pylori infections. Clarithromycin plays a crucial role in the eradication of Helicobacter pylori, the bacterium responsible for peptic ulcers and chronic gastritis. It is typically used in combination with other medications, such as proton pump inhibitors and additional antibiotics, as part of a multi-drug regimen. Successful eradication of Helicobacter pylori can help prevent the recurrence of peptic ulcers and reduce the risk of associated complications. Mycobacterial infections. Clarithromycin plays a vital role in the treatment of certain mycobacterial infections, particularly those caused by the Mycobacterium avium complex, MAC. It is often used in combination with other antimycobacterial agents, such as ethambutol or rifabutin, to enhance treatment efficacy and prevent resistance development. Clarithromycin's ability to penetrate tissues and concentrate within macrophages, where mycobacteria reside, contributes to its effectiveness in treating these infections. Skin and soft tissue infections. While not its primary indication, clarithromycin can be an effective treatment option for certain skin and soft tissue infections caused by susceptible pathogens. It may be prescribed for conditions like impetigo, cellulitis, and erysipelas, particularly in cases where resistance to other antibiotics is a concern or when alternative options are contraindicated. By understanding clarithromycin's specific roles in treating these conditions, healthcare professionals can make informed decisions regarding its appropriate use, optimizing patient outcomes and minimizing the risk of antibiotic resistance. How to take clarithromycin effectively. To maximize the effectiveness of clarithromycin and ensure successful treatment, it is crucial to follow the prescribed dosage regimen and adhere to certain guidelines. Here are some essential tips for taking clarithromycin effectively. Follow dosage instructions carefully. Take clarithromycin exactly as prescribed by your healthcare provider, following the recommended dosage and frequency. Do not adjust the dosage or stop taking the medication without consulting your healthcare provider, as this can lead to treatment failure or antibiotic resistance. Complete the full course of treatment. It is essential to complete the entire course of clarithromycin treatment, even if you start feeling better before the end of the prescribed duration. Stopping the medication prematurely can allow the remaining bacteria to survive and potentially develop resistance, leading to a relapse of the infection. Take clarithromycin with food. Clarithromycin should be taken with food or a glass of milk to improve absorption and minimize potential gastrointestinal side effects. Avoid taking clarithromycin on an empty stomach, as this can increase the risk of nausea and vomiting. Stay hydrated. Drink plenty of fluids while taking clarithromycin to help prevent dehydration, which can be a side effect of the medication, especially if you experience diarrhea. Avoid alcohol consumption. It is recommended to avoid consuming alcoholic beverages while taking clarithromycin, as alcohol can increase the risk of adverse effects and potentially interact with the medication. Report any concerning symptoms. If you experience any concerning side effects, such as severe diarrhea, abdominal pain, or allergic reactions, promptly report them to your healthcare provider. Do not attempt to self-medicate or adjust the dosage without professional guidance. Inform your healthcare provider about other medications. Disclose all medications, supplements, and herbal products you are taking to your healthcare provider to avoid potential drug interactions with clarithromycin. Some medications may require dosage adjustments or close monitoring when taken concurrently with clarithromycin. By following these guidelines and maintaining open communication with your healthcare provider, you can maximize the therapeutic benefits of clarithromycin while minimizing the risk of adverse effects or treatment failures. If you or a loved one has been prescribed clarithromycin, it is essential to understand its proper use, potential side effects, and interactions with other medications. Our team of experienced healthcare professionals is dedicated to providing comprehensive guidance and support throughout your treatment journey. Contact us today to schedule a consultation and ensure the safe and effective use of clarithromycin for your specific condition. Together, we can optimize your treatment outcomes and prioritize your overall well-being. Conclusion and final thoughts. Clarithromycin has established itself as a versatile and valuable addition to the antibiotic arsenal, offering a broad spectrum of activity and unique advantages in treating various bacterial infections.